Mhm.
So hi, I'm Dr. Hirani from Hirani Wellness in Culver City, California, and I'm here with Bethany Letourneau, who is going to talk to you and me about her journey to health.
Mhm.
So Beth, I'm going to have you start by just telling me how you're feeling today, and I'm going to tell the viewer that you have been struggling for many years. You came to me about 6 months ago. So I'd like you to just start off by telling me how you're feeling today.
How I'm feeling today is much better. I feel like I'm 80% back to health, and I have the strength that I didn't have before. I can walk. I'm sleeping finally. I have energy, and my memory's back. I'm able to eat food. And these were all wonderful things that I hadn't been able to do for the last 3 years. Yeah.
So tell us briefly when your symptoms started, what your symptoms are, the different doctors that you had to go through before you landed here in my office.
Well, my journey started about 3 years ago with a very scary hyperemesis pregnancy, and no one could help me. I couldn't eat anything for 9 months. And after I gave birth to the baby, I breastfed her for 2 months, and then I collapsed and I couldn't walk. So I went to probably 30 different doctors, I mean, aside from just being in the ER every week, and I kept saying, why can't I walk? What's going on? Why is my blood sugar dropping? I had to eat every 3 hours. I couldn't lose any weight. And the endocrinologist said, oh, you're just a diabetic. The food allergist said that's impossible, that food makes you sick. The OB, the perinatologist, I mean, no one could help me. And I didn't know what to do. I just laid in bed and just kept looking for answers because I couldn't walk. I tried to go to integrative medicine, and in holistic medicine, I saw a naturopath, and I was told it's because I'm so toxic. So that's when I started chelating and had the mercury removed, and I thought, okay, now I'll be able to walk. I've done this for 6 months, and I still couldn't walk. And I was talking to the biodentist. I said, you know, I'm really worried about my son. He's not talking. Do you have a referral? And he sent me here. And I came with my son, and I'm still waiting for the chelation and all my stuff to finish for myself. But then when I meet you for my son, for speech delay, that's when I learn about all the testing, and I find out about food sensitivities and what that can cause, and leaky gut and how that causes exhaustion and constipation and diarrhea and all the problems I was having. And I see my son, and within 2 months of no longer being covered head to toe in eczema, his skin is pink, and instead of having no words, he's starting to have a few words like, I want water. And as we follow the gluten-free, casein-free diet, and I start following it, I start taking his enzymes, I start to feel a tiny bit better, and I thought I need to come myself and to learn more and get the same test done for myself to see if I can get more answers.
So we did a lot of tests for you. We looked at mitochondrial dysfunction, we looked at nutritional deficiencies, we found some hormonal imbalances, we found some infections. Which of those tests really stands out for you?
Well, for me, it was all of them because it gave me an entire picture. I wouldn't say there's just one test. You need to know everything. To know what my food sensitivities are is definitely helpful. To start taking the supplements because I was so depleted of everything was very helpful. But to see that I have these pathogens, that I have these viruses, that I have the Lyme, it was just a big eye-opener. It was more than just people saying, oh, there's nothing wrong with you. There was something seriously wrong. And I finally had my answers so I could begin a treatment.
So one of the treatments that you did here was the UVI Ozone, and I'll tell the viewer a little bit about it, and then you can tell us your response to the UVI Ozone. So UVI Ozone is ultraviolet blood irradiation, which is, versions of it are FDA approved for cutaneous T-cell lymphoma. And basically the blood is removed from the patient, similar to a blood draw, and that blood is injected into a sterile saline bag, which is then reinfused to the patient in a closed loop system. And as it's being reinfused back, it's being exposed to a UV light box, which has 4 UV light bulbs. So every red blood cell pretty much is being exposed to the UV light, and that UV light is zapping, so to speak, bacteria or fungi or viruses, and the unhealthy cells are obviously zapped, and that mixture of healthy red blood cells and then the zapped cells are going back into the body and creating like an immune response, kind of like a vaccination, kind of like stimulating the immune system. UBI therapy has been around since the 1920s. It was first discovered by Dr. Knott. And since then, thousands of patients have been utilizing ultraviolet blood irradiation for all kinds of illnesses. It's been researched in many different conditions. Ozone therapy was also discovered around the 1920s. A Swiss dentist discovered it. Since then, ozone therapy has been used in many countries. It's very popular in Europe. It was first brought here in the 1980s and has been used intravenously. It's used in a form of injections called prolozone. And ozone is basically 3 oxygen molecules. And the ozone is generated using an oxygen tank, and the oxygen feeds into the ozone generator, and then a clear gas is generated. That clear gas is also injected into that sterile saline bag, which has the patient's blood, and then that ozonated, salinated blood is dripped back into the patient, and that's UBI ozone therapy. So, can you, sorry for the long explanation or discussion on it, but can you tell us your results with the UVI Ozone?
Well, I feel I've had tremendous results, but it's true, the first few times I did it, it was like being vaccinated, and I was so toxic that I felt very tired for 2 days after my first couple of sessions. But now, I think after 4 sessions, I could actually walk a couple of blocks, and I wasn't able to walk more than just a few minutes. I was just so surprised. I thought it would take longer for me to be back on to myself. And now I've had 10 or 12 treatments, and now I feel very strong right after I have the treatment. It's amazing.
Do you find it complementary to the antibiotics that you're also taking?
Oh, I feel like it's definitely helping me as far as feeling good and for strength. The antibiotics, I feel like I'm tired from taking the antibiotics, that my body is in a bit of a fight to overcome the viruses, but I feel like the ozone helps me to feel strong again. Yeah.
Speaking of viruses, one of the tests we did on you was the Nagalase test. And Nagalase is a test for immune dysfunction. It's been studied in cancer, it's been studied in HIV, in hepatitis, and chronic fatigue, and most recently in autism. The thought is that Nagalase is produced by tumor cells or viruses and even bad gut bacteria. And the job of Nagalase is that it's a scissor. It's a scissor enzyme that cleaves off this activating protein that activates the macrophage, which is the white blood cell that goes around getting rid of foreign invaders. So if Nagalase is elevated in your blood, as it was in yours, that's an indication that you have some active process going on, whether it's tumor cells, whether it's virus, whether it's even bad gut bacteria. And the treatment for this elevated Nagalase is GCMAF injections. So the treatment is basically weekly injections with frequent monitoring of the Nagalase. Every 5 weeks we're measuring her Nagalase levels, and the goal is to bring your Nagalase down to a level of 0.6, which is considered to be the level where your own body now is producing its own GCMAF and you don't need the injections anymore. So do you want to tell us about your experience with the GCMAF?
Oh, I take them at the same time with the ozone, and at the beginning it was the same thing. I was really tired at first, but now I just feel like I'm just getting stronger and stronger. In fact, I feel like I'm strong for a week, and after getting each shot. So, and the same thing with my son who's taking the GCMAF. He has gone from, in just I was expecting it to take much longer, 20 or so shots, but even after 4 shots, I went from a kid that's not talking, that's very rigid, that he's wearing short sleeve shirts, he's asking for a Band-Aid, and this is someone who for 4 years wouldn't let me touch him, the wind couldn't touch his skin, he was very hypersensitive to the world, and he's just come completely out of his shell, and it's beautiful to watch, to see him not be so traumatized by a t-shirt, you know.
And there's really very minimal side effects with it.
There's none, and the shot doesn't hurt. That's the best part. I don't even feel it. It's absolutely painless. I mean, so it's wonderful treatment.
For both of you.
Yeah.
Through some of the functional medicine testing that we did, we found that you had elevated yeast in your body, and we treated it. Of course, diet is key. I don't want the viewer to think that the diet doesn't play a role at all in this picture. You were put on a yeast-free, sugar-free diet, but we also put you on some nystatin. So do you want to tell us?
Well, I did the diet on my own for a year and did not achieve significant results because I had such a deep systemic yeast. So all the herbs and the things I tried for a year and the antifungals chipped at it very little. I felt like after 3 months of nystatin, I was just, this weight was taken off my body, and again, like I was able to walk and not be so exhausted. So it's just been multiple things that have helped me to get to this place now where I'm actually a real person. I can really go to the park with my kids. I can really go to the grocery store. I don't have to pick, today I'll just walk for 10 minutes and then I spend the rest of the day in bed like I did for 2 years. Now I can take care of my children, go to the grocery store, go to the park, and consider a play date if I wanted to. And I can't believe that. My dream is we're going to go to Disneyland in a few months, and that's the next step of like truly being just a regular person again after years of being laid out.
So happy for you.
Thank you.
That's just amazing. It's such an amazing story. There are a couple other treatments that you've done here at my clinic. Most recently, the pulse electromagnetic field therapy. It's otherwise known as PEMF. PEMF, versions of it are FDA approved for non-union joint fractures, joint pains, depression. We have been using it here in conjunction with some of our Lyme patients and chronic fatigue patients. We're doing a version of it we call neuro PEMF. And basically it's loops of coils that are close to the body, the head, or different parts of the body where patients may have chronic pain, etc. And it's a current is running through, and it's creating a magnetic field. And that magnetic field is basically kind of energizing your cells, and it's telling your mitochondria, hey, do your job, do what you're supposed to do. So patients, it's been used to treat chronic pain. It's been used to treat lymphedema. Lots of applications in PEMF. So why don't you tell us your experience with the PEMF?
It's a very unique, strange feeling when you have the coils on you and you feel such an intensity of it. It's not comfortable, it's not painful, but it's not comfortable. But what's so interesting is you can hear the machine making the noise. Afterwards, it's a very short session, you just feel, I can just feel all these like toxins and things being released, and my body actually goes, whoa, wait a second, what's going on? And then I get this enormous lift like the next day of, I just feel like I'm clearing things out. But the most radical thing I was so surprised about after one session was with Lyme, you have tremendous pain, and I had such a stiff neck, I just couldn't move it. And for the last year, I was trying to do yoga and stretch it and fix it every day, twice a day. And after one session of the PEMF, I didn't have any rigidity, and my neck is moving, it's not clicking. And that was last week, and I'm surprised that it's still just holding true, that it's helped me that much. It's very unique.
Yeah, it's really amazing tool. You know, to help my patients get their health back. We also gave you some hydrocortisone. Our testing revealed that you had adrenal dysfunction, so you were given some hydrocortisone. So Why don't you tell us your experience with that?
The hydrocortisone has helped a lot. I tried doing herbals for over a year to increase my adrenals with the herbals and the diet and the bovine cortex drops, and I still couldn't get to a level where I could walk. You know, I just would be laid out. So you said, let's give it a try. And the first month of being on it, it took some time for my body to acclimate to this new surge. I felt a little jittery at first, and now I just feel like a regular person. I'm not having any jitteriness. It's just helped me, and I'm just really happy to just be able to be with my kids and be able to function and be able to live and not be waiting, wow, maybe in another year or two I can walk. I just couldn't do it anymore.
Such a wonderful, so happy for you. Is there anything that you would like to tell, you know, patients that are out there with similar symptoms such as yours? Some advice that you'd like to give?
Well, it's been, it took me 40 years to get to this place. I got really ill for 3 years, and I was in bed, and really, after seeing 30 doctors and nobody really had an answer, I got very hopeless and despondent. And then I thought, there's got to be something more out there, and there is. There is integrative medicine and holistic medicine, and you can come and get answers, even if everyone's told you you're crazy or it's not true or you're just going to have to lay in bed for years. You can't accept that. You have to keep trying for yourself, and you have to keep searching for the answers. And what I liked about here was I felt like I finally got the full picture. I felt before everybody was looking at me through a very small scope of a very limited experience, and they couldn't hear everything I was saying. The allergist didn't understand why I couldn't eat food. The endocrinologist just thought I had a blood sugar problem. But here I had this huge problem that had to be addressed. It had to be the supplements. It had to be the different therapies. I had to change my diet and be responsible for my care, because I can only tell the doctor what's going on, and then you can tell me this is what we can try. And even if something didn't work at first, then I've learned something from it, and I can move forward to try the next thing. To have the options of not just herbs or just the prescriptions, to have all the options, even the therapies that are not available in regular hospitals. That's what's so great about being here.
Thank you so much, Bethany. Thank you.
You're welcome. Thank you.
You made friends with some patients, and you really are like a walking billboard for me. Yesterday you met somebody in the waiting room who was a nutraceutical rep, and she just had to get on that PMF machine after you talked to her about
I thought
it.
she was a patient. I didn't know she's a rep. How funny.
Just a rep.
Oh, how funny is that?
So I had to put her on it, but you've made some wonderful connections while getting your UVI Ozone, and you want to tell us a little bit about one of them?
About Stacy? Yeah, well, you know, when you're looking at something, when you have Lyme and you're wondering what's going to happen, I'm going to try these things, you know, does anybody else have Lyme? And there's a girl sitting next to me, just happened to have kids the same age as mine, who's was in a wheelchair trying to get her life back together. And yeah, we both are doing the same things and different things, and then we share what's working and what's not working, and we just become I feel like we have to help each other, encourage each other, remind each other there's other things. Even if something didn't work out, keep trying and keep looking. So that's been, for me, it's a blessing. It's because this is a very happy environment where I feel like my nurse Toby really takes like excellent care, and she's vested in me. The same with Kelly and Alessandro. They know my kids and they ask me how I'm doing, and I really enjoy the care. It's very thoughtful. It's very personal. And I didn't find that anywhere else at all. There was no one that actually cared about me at all. Yeah, so that's been wonderful. Yeah, it's because you need to know that even if we're not going to know everything today, we are working together as a team towards getting all those answers and to true health and fulfillment of, you know, your life's purpose, which is not to lay in bed for 2 years and not be able to walk. It's not my purpose. So I'm very eager and happy to share with whoever's sitting next with me, if they're going to try something for the first time, what my experience was and how much it's helped me. I'm very happy to. Yeah.
Thank you.
Mm-hmm.